I want to thank all of the students for attending our live AMA tonight with an amazing, amazing doctor, one of the University of Maryland's finest, Dr. Oy. I'm going to go ahead and introduce myself, and then I'm going to let her introduce herself. I know that, she was a big staple in the University of Maryland for during her time there. Everyone knows her. She was super popular there. So I'm going to let her introduce herself in a second. Thank you again, University of Maryland. I'm so happy you guys were able to join. My name is Miles Murphy. I am the Academic and Industry Relations Manager here with Aspen Dental Management. I cover PA, Maryland, and DC, so all of the dental schools that are in those states. And I work for Aspen Dental Management. We are the dental support organization that supports all of our practice owners, right? We support almost 800 offices nationwide at this point. We move very, very quickly. We open one office every 4 days. That's one thing about Aspen Dentals. We're super, super innovative. And here at Aspen Dental Management, we are the business consultant for all of our owners. So we are that backbone to help all of our owners run their practice from an operations standpoint, from a recruiting standpoint, from a marketing, real estate, finance, payroll, everything that goes into running an office and their own practice on a day-to-day basis. Aspen Dental Management helps with that. So just to kind of give you a little brief overview at a high level on what we do, I'm going to go ahead and let Dr. Oy introduce herself, and then we're going to dive into some of those questions. So again, I want to urge the students that are participating tonight that we are, this is a live AMA session. This is literally an Ask Me Anything for Dr. Oy. So please feel free to ask her any questions that come top of mind. We have a Q&A box on the bottom of your screen. So feel free to ask any questions that you guys want. I'm also going to be circling back to some of the questions that we have some of the students that submitted beforehand when they did sign up for this AMA session. So I'm going to be circling back to some of those questions as well, at the same time answering the questions that are coming in live. So I want to thank the students again. And without further ado, I'm going to open up the floor to Dr. Oy.
Hey everybody, it's so good to see some familiar names and some, well, not familiar faces, but thanks for joining and hanging out with me. Yeah, my name is Dr. Maria Oy, and I had just graduated this past year in 2020. Some of my experiences, or I guess like some of my background is that I grew up in Delaware. I went to the University of Maryland for undergrad, took a gap year, then I came to Maryland again for dental school. In my third year, I was the secretary of ASDA, which I think helped put this event together. And I think that's when I started getting to learn about Aspen. And then in my fourth year, I was actually chosen to be part of the Diamond Scholars program, which was super awesome. It gave me a lot of experience that I think helped prepare me to kind of navigate the real world dentistry and life after graduation. I know I graduated in 2020, so things are kind of on a whirl with COVID, and maybe it's not the typical graduate experience, but I am happy to share everything that I've experienced with you because you guys are also part of the COVID class. So if you guys know me, I think like I literally have no papers here or anything. Like I don't know any of the questions. I'm pretty blunt and straight up, and I try to be nice, but I also like don't like sugarcoat things. So please feel free to ask anything.
Thank you, Dr. Oy. It's actually funny that you mentioned like the COVID class because I remember when we first met was kind of around when the first wave of COVID started happening. So you were kind of part of that as well. Like you're the back end of your D4 year. You were kind of going through the motions of adapting to COVID and the pandemic that we're currently still in, unfortunately now. So you're super relatable to some of the students that are on this call, especially some of the D4s who are experienced kind of, that clinic experience during this pandemic. So it's great for you to be able to testament to that. So we're going to start off with the first question here. Dr. Oy, why did you choose Aspen Dental? You have so many options, right? When you're in dental school, you're doing your research, you're looking to see what's out there and where you want to start your professional career. So why did you choose Aspen Dental?
So for me, COVID could definitely played a role in it because to be honest, like it wasn't my first choice, and it wasn't even after I signed our agreement or our contract. Like, it wasn't something I was like sure if I was going to commit to. So point blank about that. But in the end, I'm really glad I chose it because the opportunity that was presented to me fit the life and the job security that I wanted. So for me, a big part, I had met my boyfriend through dental school, and we had chosen to try to be in Philadelphia together. Being in originally from Delaware, it was a good city for me to be close by to family. And the opportunity Aspen offered was actually to open a brand new office, the first Aspen office in the Philly market and also New Jersey. So it's kind of a big risk, but I think about it, if it wasn't supported by a DSO or any other organization, I wouldn't get this opportunity to kind of build an office and make it my own and learn dentistry, grow in my skill set, as well as the practice management side as the practice grows. And I felt like just a lot safer knowing that there's the support of the DSO. I'm honest, I like had interviewed to a lot of other practices, and it's kind of like 4 operatories. I didn't even know how COVID was going to affect them, and I was just kind of tired at that point too, because nobody knew what was going to happen. I also didn't know what was going to happen with Aspen too, but I just felt like I could trust it a little more, and I was willing to take that risk.
Awesome. Thank you. Thank you for that, Dr. Oy. And I like that one of the students asked a question that kind of segues and kind of relates to the your answer that you just answered, was wondering when you started interviewing with Aspen and when you accepted a job offer. They're curious about the timeline of it.
Yeah, so a little more about that. I think I was really big on wanting to pursue residency. And of course, that's changed with COVID because a lot of programs have changed in what they're able to offer. So I actually didn't get matched to a Philly GPR. So I started my job search the day after post-match. And let's see, I knew that that's kind of when the floodgates open. All the other students would start looking for jobs at that time. So I wanted to make sure that I hit Aspen and Heartland and like the big corporation DSOs like early on, so that I would be their number 1 candidate when they're picking through all the students. And I talked early on with Aspen. There's like some phone interviews. I got to talk to the mentor doctor that I would be working with and who would be teaching me everything as a brand new dentist. And around the end of February, there was actually the Aspen Vibe event where I just got to like learn about the culture, meet so many different doctors, hear all the different stories, and understand kind of everything that Aspen had to offer as far as mentorship, CE, how the organization is organized. So I signed my agreement then. And I still talked around to like other private offices in early March. That's when COVID hit. And I was like, I mean, we're up in the air, but like, I think Aspen's the way to go because it was already a risky thing anyways, or like, I didn't know what was going to happen with the new office. But I think one interesting stat with COVID too is that Aspen's market has skyrocketed. Well, maybe not skyrocketed, but it didn't plummet. It didn't stay stable. It like steadily increased through the pandemic because we stayed open through a lot of it, or we're not hit with a shortage of supplies and everything. So because of that, it was a lot of job security as far as what the opportunity itself held.
Awesome. Thank you, doctor. So I love that you also mentioned, it's kind of funny that you mentioned Vibe because you were part of our last in-person Vibe event. So it was in February, I believe. That was our last in-person one. So we actually have one coming up this Saturday, February 6th, and it's virtual now. So this would be our 3rd virtual one. So you were one of the last lucky ones to kind of experience that weekend of Vibe. So if any students have any questions about Vibe, please feel free to ask. So thank you, Dr. Oy. There's a couple points that you mentioned in your last answer that I want to touch upon, was mentorship. So what did your mentorship experience look like, and what were you actually looking for while you were still in dental school?
So at the end of dental school, like if COVID didn't happen and clinic was still open, I was going to dedicate like my last 3 months to like being in the school as often as I can, working with like the pre-docs, but also like the specialty programs and just kind of getting all that I can from the specialists, because When we're here in this office now, we have an oral surgeon who comes once a month. We have an endodontist who comes once a month. But I know a lot of it would be from who I work with day to day. And I think that's why I trusted my mentor in Aspen more than kind of going on another route for job opportunities. My mentor dentist, she's young, and it wasn't until I interviewed that for me as a young female dentist, like I wanted a young female mentor. I just felt like it would be a lot more comfortable for me. I'm not stressed about impressing or being fired every day. It was just a really good opportunity for me to be able to like, hey doc, like, what do you think of this x-ray? Do you think this is cavities? Like, let's look at it from a different angle. What do you think about this root canal? Should we do it? Should we not? So it's a lot of one-on-one feedback. I learned a lot of cool techniques from her too, just because she was trained in the Midwest. She's 5 years ahead of me. So just kind of seeing like how she works or like what experience she has. She's very well-rounded. So kind of like monkey see, monkey do. Like when we opened this office, we were just kind of like, let's not do molar root canal. Let's save it for the specialist. She started to do some, and then I started to do some. Today, I did an upper, like number 15, took me like 45 minutes. It went super smooth. And like, you know, that's just kind of the mentorship and the growth that like now I've surpassed my mentor in like one aspect. But I love having her in the office just to be able to help me grow and learn. And practice management is also a huge thing too. As an associate dentist, you don't have to do it, but that was something that I wanted to work on because I want to grow and maybe be a lead dentist or an owner dentist one day. So that's been challenging. Like, what do you think about this team member? Working with interviews, if there's a hurdle, how can we overcome it and really build a strong office culture?
Yeah, that's awesome. So that's one of the biggest questions I always receive from all of my students is, what does mentorship look like? Because sometimes it can be a scary time, right, doctor? Or like it can be scary when, you know, you're about to graduate, you're in your D4 year, and you know, you may not be so comfortable to step right into work. And it's great. We just got a question that they mentioned. So they're not sure if you'll be able to answer this since you've been with Aspen since graduating. But what is your role at Aspen, and how does that differ from a residency? So if you're familiar with like how residencies work and you know how your first year at Aspen Dental worked, you can kind of compare the two.
Yeah, so I think I can definitely speak to that because I was part of the Diamond Scholar program, which is in AGD. I would say like residency, you are solely a student. You're there to learn. I mean, you are the doctor. You're going to start making your own decisions, but you have all the like multiple faculty to learn from. In Aspen or just my mentorship, I kind of only have like that one person, which is why for me it was important in my last 3 months to like make connections with the endo residents or to meet the endodontists around this Philly area, and so on. I think Aspen, like I had told Miles this before, but it's kind of like for me, private practice residency, because I'm learning how to manage not only like a single column, which that's all you might focus on in a GPR or an AGD, but like I have to handle a column of procedures. I have to handle a column of new patients and a column of overflow, and just be able to kind of weave in and out, like know how to do dentures, or if I didn't, like I would learn from my mentor. But the learning I think is a little bit quicker because you have more patients to see because you have an office to keep going. Just number wise too, I think I had a super awesome opportunity just to have gotten a lot of experience in dental school, but it's nowhere near what you're going to do in a practice. Residency, I think, is a step in between because I talked to plenty of my classmates, and we're definitely comparing numbers. And I'll say from here, or from when I started in like this office opened September, October, November, December, January, like 5 months in, I've counted, I've done probably about 400 root canals, or sorry, not 400 root canals, 400 extractions. I think like 60 root canals, probably like 400 fillings, and what else is there? Crowns, like 100 crowns at this point. And from what I'm seeing with my friends, like they're just not getting those numbers in residency.
Awesome. Thank you, doctor. And we have a follow-up question regarding the mentorship. Does everyone get a mentor if they join Aspen Dental? I'll go ahead and answer that. Yes, absolutely. We have a very extensive doctor development program. where every doctor that joins Aspen Dental, you are getting paired with a mentor doctor. We have something called get acclimated to Aspen, which within your first 3 months, you'll get acclimated to Aspen. You'll come out. You'll learn from a more experienced, a mentor doctor, and you'll be able to ask them any questions you have. You'll learn a little bit more about the treatment planning. You'll learn how to work some of the systems in the office. How to navigate with the patients, etc. And then we also have something called Beyond the Chair as well, which this kind of ties upon CE. We do offer CE. Before the pandemic, we were offering Beyond the Chair, where we'll fly you out to our headquarters, and you can absolutely take some CE courses live with some of our mentor doctors as well, with whichever procedures you want to learn about. We offer it. So we really believe in our doctor development, and we believe that you have full autonomy over your career, and we absolutely want to provide that for all of our doctors. So we have a question that came in regarding procedures. So what is your flexibility like in terms of procedures you do and you don't do, aka refer out?
So 100% flexible, 100% full autonomy. Nobody's coming in and saying, you need a treatment plan more crowns, you're not treatment planning aggressive enough, or whatever. Nobody's telling me how to treatment plan. It's my dentist career. It's my license. And I'm the one looking at the x-rays and making the clinical calls. Because I'm working with another doctor in this office, pretty much she's good at like everything. So we actually don't refer out that much. But if a patient like has wisdom teeth that like we're not gonna feel confident at, because even if we could do it, we want to be at the level or better than the specialist. We don't want to spend 3 hours on a wisdom tooth extraction when our oral surgeon can come in and do it for an hour or faster. But referring out to an outside practice or to our specialist, we always have that opportunity. And if there's something that I don't feel comfortable with, but she does, she'll put it in her column and make sure she does that procedure. Same thing the other way around, like how I did number 15 root canal today. And you kind of just get a feel for like what you're good at, or like what you still need work on. So for me, like full mouth extractions still give me a little trouble. I'm still like not 100% confident on every single one, but I love having her in the office because I can keep challenging myself and pushing myself. She's not forcing me to do it. I'm kind of choosing my own struggles there, but it's easier for the patient too, because they'll be like, hey, like we've been at this for a while, like let me get Dr. Niv to come in and take a peek, and she'll just finish up the procedure at that point. But no, I've never been forced, and I think that's a huge thing. Whether you're at Aspen or like any other first practice that you're out there, figure out who's treatment planning, why they're treatment planning the way they are, and who's going to be doing the procedure. There's some places where like the top doctor there will treatment plan everything and take all the big cases, and you're just stuck being an operative minion.
Awesome. Thank you, doctor. I know Dr. Niv as well. She's awesome. So there's a question that just came in regarding patient flow. How many patients did you see in day one straight from dental school? Was there pressure to take on more? What does that look like for you, doctor?
Sure. So I was very happy with how I was trained and onboard into the Aspen system. So my very first day, I actually just shadowed for 2 weeks at a very established Aspen office nearby. And then the next 2 weeks, that's when I like met up with Dr. Niv, and we were actually helping out in another office, and we were doing some procedures together. Then when we opened this office, it's kind of just based on who's walking through the door because it's a brand new office. But the focus was always for me to just focus on whatever procedure and whatever quality, or like good quality on whatever thing I'm doing, never compromise on quality. My very first day in our office, I think I got worked into doing like a filling and crown prep. And it probably took me like 3 hours to do, but she handled all other 17 patients on the floor, and we made it through the day. So I think my onboarding was really helpful because I was able to kind of have a card and say like, I need this much time for this procedure. And my baseline was probably like 90 minutes for pretty much anything. And now I'm working at like a 60-minute, like 1 hour schedule. Nobody's forcing me to do it, but you feel like you just kind of want to be better and take on more. If you're feeling ambitious, like I think it's awesome because there's so much room for growth here. And I feel like I'm kind of ambitious, or I want to be as good as her, or like as a dentist who has been practicing for a while. So sometimes I get behind, but it's awesome having her because she'll pick up where I get too slow, maybe.
That's great, Doctor. Thank you. We have a question that came in regarding culture at all Aspen Dentals, or is that just your office? I can kind of jump in on this as well. I think that they mean with the culture. I think the point that they want to drive home is the support aspect that you previously mentioned. I will be a testament to this, that we do offer all of our doctors support, whether they're newer grad like Dr. Oy or one of the, doctors that been practicing for 10 to 20 years. We do want to make sure that we provide you that full range of support. There aren't any procedure goals. I know that's one of kind of like the perceptions at Aspen Dental or other dental services organization, that they're procedure goals, or that, we're a denture mill, or we push treatment on patients that they don't need necessarily. But I think Dr. Oy can also speak to this, is that, we want to just make sure that you're comfortable with what you're doing, and we want to give you full autonomy and full support. So if you're not comfortable with doing the procedure, you can absolutely refer it out to one of our specialists, or if you need a second opinion, you can absolutely go to your lead doctor on something. So we just want to make sure that, you're striving to be the best doctor that you can be. We don't quote unquote throw you into the fire. Maria, Dr. Oy, I'm sorry, she pretty much can speak to that as well. She was coming out of Maryland, and starting her first day and getting acclimated to Aspen and having that mentor, and just kind of learning as she goes. And now, I would want to say, she's a very, very successful doctor. And I know you've absolutely come a long way from when you first started day one. So I don't know if you want to chime into that, but if you want to speak to more about the culture at your office, or what I know that you have some friends that work with us as well. So what do you hear?
Yeah, I think Aspen is really awesome in being supportive for the doctors. Like there's literally a whole team that like supports the office and supports the doctor. All the other personnel, like dental assistants, the front desk, like there's the whole other group in Aspen that helps with their development too. So I think we definitely get plenty of support, but whether it's Aspen or like somewhere outside, I think just taking the time to reflect and think about kind of what your goals are, and just making that known or making that transparent. Because I've met some other new grads that maybe haven't had as great of a time, and I'm like, hey, did you like talk to this person? Did you share your thoughts with anybody, or did you reach out to this person for success? And I'll say too, for our brand new office, like it's tough, like it's not a walk in the park. I'm exhausted every day. But the like one time I felt like I was just kind of lost. Dr. Div was spread thin, and it was like, who else can I reach out to? I reached out to somebody in Texas, and she was able to kind of rejuvenate me and give me such great advice that was specific to Aspen, how to navigate that hierarchy too, and just really be able to find the right person that's going to be able to support me in this office in the right way. So it's kind of a two-way street. Like the support is there, but you also got to be willing to kind of navigate it. It's like dental school, honestly, but better if you think dental school is terrible.
Yeah, that's great. And I also like that you mentioned we have a whole team. Like I previously mentioned on the beginning of the session, was Aspen Dental Management, we have our own team that supports all of our doctors and all of our owners. So you have your owner doctor that you can go to give you that support or answer any questions that you have, or just to speak to. But then we also have our directors as well, who are on our operations team, to make sure you're getting the best experience possible, to make sure you have everything you need in your office, to make sure that they're there and they're available to, if you want to speak to them, they're absolutely available for you to go to. And, if you want to make a change, or if you want something, or if you want, different equipment, you can partner with your director and your owner, or whatever it is, to make sure that you're comfortable, and that you're having the best experience and the best work experience possible. That's what we want to ensure. So We have another question that came in regarding, did you have a problem finding a job at Aspen, or was it easy? If you just want to give your experience, maybe if you want to touch upon vibe a little bit, or your interview experience, like how did that go, Dr. Oy?
Yeah, so I think because I've done it both with Aspen and just like outside practices too, I think it's a little scary sometimes saying it's like, hey, I think I'm a good student. Like I worked really hard, I accomplished a lot, but I still don't know everything and I still want to learn. That's a little scary for when you're applying somewhere and they're like, we kind of just need somebody who's able to, like, I don't want to teach them, I don't want to mentor them. I want to hire a doctor for my office that's able to do the thing. So that's definitely being vulnerable and a little scary, but I think Aspen, they're able to navigate, or they know who all the doctors are in like the whole country. So they'll be able to find you the right fit. When you get a little more specific, like I only want to be in this area, like I definitely think I got super lucky because I acted early and saying, I want Philly, like when that Philly office opens, like please, like pick me. But like there's so much opportunity in Aspen. If you're flexible, you'll be able to have not something, no problem. But maybe finding that sweet spot of like what is too rural or too suburban for you. You might need to compromise a little bit. But yeah, I would definitely share your thoughts, share your concerns, and we'll see what can happen. Because if you don't say anything, nobody's going to know what you might be looking for.
Awesome. Thank you, doctor. And I want to expand on that a little bit because we got a question that came in beforehand. One of the students submitted it when they signed up regarding location. And location is a big thing with all of the students nationwide. Like they have a certain location that they want to be in, whether it's family, whether it's a significant other, whether they're just curious, whether that's their hometown, whatever it is. That's something that's important to them. So how important was location to you, Dr. Oy, when you were making your decision, starting your professional career with Aspen, when you were looking around, whatever the case was, what did location mean to you when you first started your career?
So for me, location was huge because I just felt like my life until that point was always something temporary or something in transition. And I'm just tired of moving. I kind of want to just kind of establish myself. A big part of that too, I think, is I realized dentistry, it's something that you practice over time. I switched from GP3 to AGD. So even in dental school, I didn't even get the same patient pool that I worked with. It changed things every year. And the scary thing with dentistry, you don't know how good your work is until you start seeing patients for recall, until you start taking x-rays. And for me, I wanted to make sure that when I start, I just kind of want to know that I'm going to be in that one place for a little while. So for me, Philly being close to home, knowing that it's also an area that has plenty of opportunities for dentists in general, because it's not just me, but it's my boyfriend too, who's currently doing residency. But we just wanted to make sure that we'd be able to be flexible. And let's say we end up moving. The good thing is, like, hopefully we'll have an opportunity with Aspen, wherever that is, because it's everywhere in the country. And I think it's nice to be supported and comforted, and like one less thing for you to worry about when you're like looking for a house, like trying to deal with kids or all the grown-up stuff.
Awesome. Thank you. So I want to segue a little bit to a question that comes up all the time when I'm talking with students. So what about treatment planning, right? Let's talk about that a little bit. You do have exposure to treatment planning while you're in dental school. When you transition to Aspen Dental and when you started your career, do you have full autonomy over your treatment planning? What does that look like? Are you able to get a second opinion? How does that look like from your perspective and your experience?
Sure. So I think something that makes Aspen different is that we prioritize the new patient experience. A lot of patients have some kind of barrier, not just finances, but when they're finally in our doors, we want to like just try to get work done for them if we can that same day, because it already probably took a lot for them to just get to that point. So we always have a new patient column. My office is brand new. We see on average like 8 new patients a day. So from the second our door opens, like there's going to be x-rays that pull up. usually I look through the pan, check for like the big pathology, and then I pull up like all the individual PAs and just kind of go through that. And, you know, in my mind, I'm thinking of it just like Marilyn had taught us. So obviously the big stuff, but look at acute treatment or like the immediate parts of disease control, getting the root canals done, the extractions, and then looking at doing the fillings and then the restorative work with crowns, bridge, dentures. So I think for me too, just because I like the help, I like the second opinion. I'm kind of competitive, or I like if I like exams, I'm like, hey, like let me see if Dr. Nib gets like the exact same treatment plan I came up with, which works out because we're pretty similar. But yeah, it's awesome there, just to have that second opinion, that second set of eyes. I know that like when I'm the lead dentist, when I'm solo, like I'm gonna have to make all the calls myself. And the biggest thing from having Dr. Niv here versus just me being by myself, it's just going to be speed, but that's going to come with time. And I like having somebody to observe too, just because it's going to be my license at the end of the day and my calls. And I just want to be able to make sure that I recommend the treatment options that I'm able to do to make sure it's successful treatment. One thing that kind of turned me off elsewhere was that they said only propose one treatment plan. And it was like, that's a big no at Maryland. Like you got to give the patient all their options and let them know kind of the treatment that's there. You kind of find that sweet spot too, just from time and practice, I think, for what works for you, the verbiage, how you present things to patients without making it too confusing, but also an efficient appointment so that they don't leave like super confused or like, oh, let me go home and think about it, then they never come back.
That's great. I love that you went in depth upon that, because that's something that I get all the time from students is, how does our treatment planning look like? Are we able day one to create our own treatment plan? What if we're not comfortable with it? What if we want 100% ownership on it? What if we want a second set of eyes? So it's great that you were able to dive into that and share your experience. Want to ask you another question regarding scheduling, like your schedule. I know that you did touch upon the 3-column earlier in the session. What does your schedule look like from a day-to-day, week-to-week basis? I can imagine it being, pretty hectic with 8 new patients a day. How does that look like for you, Dr. Oy?
Sure. So let's see. As far like we always want to make sure that our columns are filled. I don't push for the new patients. Like that's based on like call center or patients calling for themselves to get themselves scheduled for a new patient exam. But procedures, we're a new practice, so we're building it up, but we're open, like 7:30 to 5:30, 3 days a week. It's just an 8-hour day. I'm a morning person, so that works for me. But I just try to schedule on the hours. So I think that ends up being about like 8 procedures a day. Obviously, like if I'm doing a bigger one, like a 7-unit bridge, like I'll book it out for 2 hours. Like I can control that. That's no problem at all. And then the overflow, what's in there, it's like patients who had an extraction and then we're just checking their socket, making sure it's good, doing like a denture impression or any of the denture steps, even deliveries don't take that long for dentures. So that's a little bit more about my schedule. And as far as like you have a patient in your chair, what is the next step for that patient's treatment? I make sure that at the beginning of the day, because once the day starts, it's just kind of go, go, go. But I want to make sure that I know all the treatment that I'm doing on whatever patient that day. And I also know the next steps. That way I can be like, hey, Miles, like we just finished your filling. Either like your next visit is already scheduled. It's the 6-month visit. So we'll do your cleaning then, or it's like, we finished your root canal. Like, do you want to get scheduled for that crown prep now? And then of course, like I don't have to be the one to schedule them, but at least I can bring my paper or my note to the next person and say, hey, like this is Miles here. We just finished his filling. The next step is this. Can you get him scheduled? I'll need an hour time block or a 90-minute time block. They'll be able to do it for me.
Awesome. And to follow up on that, we had a question regarding your hours weekly. Are you working? What does your hours look like? Are you working Monday through Friday, 8 hours a day? How does that look like on you? Is it pretty consistent?
Yeah, so my hours are consistent. It also depends on which specific office you're in. I believe Aspen tries to do like one day is a late day. It doesn't mean you work longer, it's just shifted to later hours in the day, and one day is a half day. So Monday, Wednesday, Thursday, Friday. Thursday is my late, or sorry, Monday, Tuesday, Wednesday, Thursday. Thursdays are my late days. We start at 9 o'clock instead of 7:30. But we, I think, do 9 hour days. And then it makes up for it on Friday because we have a half day, which is so nice. And then Saturdays, well, we're a new office, so we want to try to work Saturdays and appeal to the new market here. But it's just a half day on one Saturday a month. So it's a 40-hour office open hours week. And of course, like, if I like want to, just like hang out during lunch here or like talk to people instead of writing my visit notes, because we have a lot of patients, I might write like my visit notes over the weekend. I actually like that in school, like I was obsessed with Axiom. Like it was on my laptop all the time. Here we have our Axiom called EPMS, and you can access it on your laptop, and my laptop is about to crash. So I can't access it on my laptop. You also can't access X-rays at home. So I've kind of liked those restrictions for me because it forces me to not work and just remember that like my time at home is my time. And my mentor, she never forces me to like make sure I like get in, like do extra hours, like get things done. She's not breathing down my neck. It's my career, and everything like I want to overachieve, like I do on my own terms.
Great. Thank you, Dr. Oy. So let's dive into compensation a little bit without going into numbers, without mentioning any numbers. Let's just touch the surface upon what the structure looks like. What does the compensation structure look like for you at Aspen Dental? And did that shift your decision making at all, or how do you feel about that?
So I guess overall, with us, we'll start with Aspen because I'm here. What we have is a daily guarantee, and then if the office does successful, which I like because it's not just based on my production or my success. We want each person to be successful. Like we want to support hygiene, we want to support the dental assistants. So based on how successful the office is or how much the office profits, we get a cut of that. So because it's an office profit that we share, the percentage is going to be a little low compared to whatever contracts you might find outside. But I think as a new grad, I really appreciate just having a daily guarantee that when you achieve well, like you get compensated for that, but there's no draw. I never have to pay back what we might not have just because patients aren't through the door. Or like today, like with a snow day. So I like that I can really devote my first year to learning and not being stressed about like making sure I'm able to pay the bill because I didn't like make enough. I didn't see enough patients to make my daily minimum. Like that's never a case, but it could be a case somewhere else. So when you see maybe smaller percentages to like a different contract, like that's the reason why. But you also look at what the daily guarantee is and what that percentage is. Sometimes places offer like a lower daily guarantee because they know that they're going to have all that patient volume and just be able to know that you're going to be compensated based on your production or based on the collections. Is it worth the amount of work I do? For sure, because for me, like I said, I want to be able to be on that ownership path, be a lead dentist on my own. So the extra work that I'm doing isn't really even dentistry. It's all like the practice management, but I know in the end, it's going to benefit me. It's going to help me come up with the systems and be like, office manager, here's a checklist for getting through your day. DA, same thing for you. Like, here's a system for being able to sterilize instruments. It's all the extra work I feel like I'm doing, it's all knowledge or me being able to build my own practice. So whether I'm here or I move to a different Aspen or I leave Aspen altogether, which I don't think I'm going to do, but like it's all that knowledge that I think is going to be so worth it because everything's so organized already.
Thank you, Doctor. We have a question that came in. They don't mean to focus on negatives, but are there any aspects where you might not be a fan of or you think might not be for everyone? I think maybe we can focus on like that second part of the question. Like, what do you think coming into Aspen Dental, you started working and you felt like, hey, like, this might not be for everyone. Like, what is your experience? If it's none, you can absolutely say none. If you have something that comes top of mind, you can share it. But that's the point of this. We want to make sure that you're sharing your experience. So what would you say that would be?
Yeah, so I would say, like, remember, as an associate, you don't have to be doing all the extra work on practice management. That should be done by like your lead dentist. That should be done by the owner dentist. But I like that I have the opportunity to do that if I want. Some people too, like, again, it depends on kind of the shared success of the office. And, you know, if you're a really good dentist, but you're not in a great office that everybody wants to hustle, everybody wants to work hard, you're not going to benefit well from that. Another thing too is the new patient focus. Like I said, we focus on breaking down those barriers. But a lot of other private offices, they don't do a 3-column schedule. They don't see 8 new patients a day. If you get a new patient, if you're lucky, it'll be worked into your procedure column. So maybe the busyness is not for everybody, but also just being able to vibe with your mentor and know what their expectations are and what you're looking to get out of it too. The last thing I would say is that for me, the CE, right now, getting implant trained is a little difficult because I'm in a new office right now, and we haven't established our oral surgeon yet. He is already hired with Aspen. He's been an oral surgeon for a long time though, but he still has to get credentialed in this specific office. So for me, if my oral surgeon isn't able to place implants or he's too expensive because he's a specialist, I might not have as many to restore. And then if I don't have a lot to restore, I can't qualify for their course to be able to do the surgical implant training. That's not going to be the case for everybody because, again, it depends on the market you're in, how established it is. Like, you could have implants flowing through the door. But for me right now, in a new market, in a new office, that's been one of my struggles.
Thank you, doctor. Let's shift gears here. We have a question that came in regarding COVID. So, what changes is your office specifically making when it comes to COVID? Any precautionary measures? Obviously, social distancing, but what are some of the measures that you're taking for COVID and when patients come in?
So I think it starts with the employees for sure. So all the employees, when we enter, we check our temperatures, we record them. And we actually had a COVID scare once in our office. Somebody had tested positive. She alerted the office. We actually had to close the office, or the rule was that whoever wanted to come in and work the next day, you had to present a negative COVID test before you could work. So that was kind of the rule because it starts with the providers. And then as far as our patients, we have a screening measure, and then we always take their temperature when they walk through the door, especially if they have concerns. We'll tell them, we're like, hey, this is our sterilization. This is like what's touching your mouth and how it hasn't touched other people's mouth, or this is like the furnace that it goes through. So we're more than happy to explain our normal sanitization or our special sanitization things with COVID to our patients. And I think another big benefit is by being with a larger organization is that I don't think we ever had a shortage of PPE, which I think was huge with a lot of other offices. Aspen was able to stay open because they bulk order everything. Never had glove shortages. I don't know what other shortages there are, but it's like we have all that and I feel perfectly safe. I'll even say that when we had that employee who tested positive, all of the rest of us got tests and we were all negative. So with our double mask precautions, and even I think that's the biggest show, like we don't have COVID spreading through our office. And that was a long time ago too.
Thank you, doctor. You had a mask on when you joined the session, so I know that you guys are taking the correct action and being as safe as possible. I want to dive in to your office and your team. So here at Aspen Dental, we like to ensure that it is a teamwork environment. I know that you can testament to that. You mentioned your lead dentist, your owner, your mentor, your hygienist, your DA, and also your specialty. So what does the team look like in your office, and what is your relationship with them?
Sure. So I guess like seat by seat, like we have our PSR, who's like our front desk person. She's calling patients, confirming them. getting their insurance information, and between her, our office manager, and our assistant office manager, they're putting in all the insurance information, confirming them, and making sure that the patient's ready to go once they're here. We have our dental assistants take the x-rays. I'm just kind of going through a new patient exam in my head, but we have dental assistants who take our x-rays. We want to make it conversational. We want them to hype up, like, hey, we have a CBCT here, like, look at our Artera scan. We have all the technology here, which I think is awesome. Next, our hygienist will go in, she'll do the perio charting and determining the hygiene treatment plan, which is cool. Then the patient will meet the doctors. And then after that, I don't actually talk about finances. I try to get a general idea, but our consultants, who sometimes overlap with our office manager or the assistant office manager, they're the ones that's like, well, this is the treatment that needs to be done. Okay, how do you want to pay? Do you want monthly payment plans? Do you need financing? What day of the week works for you? They'll deal with the scheduling and just kind of get the patient on that treatment roll. Another really unique thing about Aspen is that we have an on-site lab. So dentures have never been easier because they are terrible in school, but his name is John. He makes all the dentures here. We'll send out for like metal frameworks, and we have our scanner, so we'll scan for the crown, but then he doesn't mill the crown in this lab here. So it's been really cool to have him pour up the impressions, or I'll even show him, like, is this an acceptable impression? And be like, no, doc, take it again. So it's instant feedback right there. And I think that's why dentures have been like really nice here, because we'll take the impression. If the patient's willing to wait an hour, we can do the wax bite or jaw relations. And then if the patient's willing to wait another hour, we can do the teeth try in the same day. So sometimes I can get dentures like in 2 days, which I think is just an incredible service to the patient, but we wouldn't be able to do that without a lab tech here. So that's kind of all the personnel in our office. And my relationship with them, they respect me a lot, which I think is awesome because I'm the doctor. And I also do respect them a lot too, because I don't want to be taking x-rays anymore. I don't want to perio chart. I don't want to pour in my impressions. So it's definitely like an intercombined relationship, and we definitely try to make it fun too, because we work hard, but we also like try to play hard. So we planned a bowling night for the month of February, and I'm like sending in my tryout video, like with my swing or my lunge, whatever. And you know, it's good because any negative energy that there might be, like you didn't do this x-ray right or whatever, we can take it out on bowling, and you know, we come the next day and we'll have like some things to laugh about and just move on and, you know, focus on patient care, which is what it's all about.
Awesome. Bowling night, that sounds like so much fun. I'm gonna bring that to my team because we've been all virtual for this past year. So thank you for sharing that, Dr. Oy. I want to ask one question. You kind of just incorporated this into, you know, some of your answers regarding career development with Aspen Dental. So what does that look like, right? Like you started out of school, you started as an associate, and then you have your lead dentist and then your owner dentist as well. So what does the career development look like at Aspen Dental? What would be your next step, and what would that mean for you?
So my next step, as my owner dentist, who's my mentor dentist, as she looks to open other offices, I'm hoping to become the lead dentist here when I'm solo. And as lead dentist, you know, you're the only one, you're the one making all the clinical decisions. And I might even be responsible for training the next associate here, so that we just have an awesome team of Aspen dentists, you know? So I think lead dentist, I think, is a great goal because it's like being a mini owner for whatever office you're working in, and you still get to do plenty of dentistry. When some owners have like multiple offices, you're not really being a dentist. You're just kind of being like a practice manager in that aspect. And for me, I think like I'm super thrilled by the idea of being lead dentist. Obviously, as you move up, as you get a promotion, like the compensation is a little bit better. And I think what speaks to kind of the organization too, again, is just like, I don't have to deal with on call. Like we have a call center that deals with that. Or like if there's a patient with an emergency, like I'm personally like not necessarily being bothered. There's some calls like I get to make, like if I was the lead dentist, like about the snow day or like personnel office staff being able to come in. But I also don't have to worry about building lease, the electricity bill, and how are we going to get more patients with marketing? Like the ADMI, like they deal with that. So it's a nice step, because if I were to open a practice from scratch, I think there is so much going on that I just don't know about. So it's good to have that support. I guess like the other option too that I want to say is, like, right now I'm an associate, but I'm working my way up towards becoming a lead dentist. If you don't want to be the lead dentist, you can stay as an associate. Plenty of people do that because they want to come 9 to 5, do their dentistry, go home, peace out, like not think about anything. And that's what they want, and that's what they do. So I think there's a lot of different options that you can go with and still be a dentist.
Great, great. Thank you, doctor. So we have a question that came in regarding GPR AEGD. I know now, we're kind of in a unique time, right? I have some of my schools, for example, Howard, they're not currently in clinic. They're not getting that exposure to helping patients. Other schools are super, super limited. It was a little bit different for when you were a D4, you were getting that exposure, you were getting that experience. I mean, you felt comfortable to be able to work right away. So what would be your biggest piece of advice for maybe a student that's a D4 now and they're not so comfortable? They're considering a GPR or AEGD of some point. What would be your biggest recommendation and piece of advice for a student that's still kind of on the fence on going to work right away or continuing their education?
So I would definitely kind of put out your feelers and start the conversation with your mentor. Like, you can start a conversation with me and I can tell you, like, hey, maybe like this is a better idea for you. But until you start talking, I don't think you can get the people to help you the way that you need them to. So I think, like, if you do really well in a school setting, then maybe an AEGD is good. To me, it kind of feels like a 5th year of dentistry or of dental school. If you want something a little more interesting, or to do some weird things, or like get a little more surgery experience, whether that's implants, extractions, or like OR cases of like drilling the jaw or something, like a GPR can be awesome. The way I saw it is that to me, I thought like an AEGD was kind of like getting better at the procedures that you'll do in private practice. Whereas a GPR, you're going to come out of that fearless. Like, you've seen like plus things like this big, and like you're not going to be afraid of that anymore. And then like if you're interested in maybe working straight out, again, I think mentorship is the biggest thing, and just seeing like who are you going to be paired with, and what do you want, what are they able to offer you. Because for me, I'm actually really glad I didn't match into residency. I didn't match into a GPR because with COVID, like half the procedures got canceled. And for me, like, I know the way I learn, I'm kind of tired of a school setting, but I also learn just from repetition and getting in there. And like I said, all my stats before, like that number of root canals, that number of extractions, like I feel like I've got it down by now. And without those numbers for me, because that's how I learn, like I don't think I'd be the dentist at this time if I like had gone to residency. So it's very personalized. Think about what you want. Talk to me. I'm more than happy to help. And yeah, we'll figure out what's best for you.
Awesome. Thank you, doctor. So we're coming up on 5 minutes here. I want to ask you a couple more questions. That's going to be super relatable, a little bit personal, regarding your experience in dental school. And then I'm going to ask you one last question that I think all of the students and even I'm interested about. So you were involved with ASDA at Maryland, correct? So what made you want to get a part of that? I know that not all students get involved with ASDA. Some do, some don't. Some want to be leaders, some don't. What made you want to be a part of that?
I think ASDA is kind of like a one-stop shop. There's so many like little committees in it. Like, you have advocacy, which I was not interested in at all. There's like the wellness, what is there? Kind of like personal branding and getting you ready for the real world and private practice. So I just thought ASDA had so much to offer. And I think the biggest thing, I'm definitely like, I like talking and doing presentations, but other than that, like, I'm an introvert. I'm a people observer. So networking is hard. ASDA would like force me to network. Like, it was just easy that way because they have the conferences, or, too, like I want to attribute like my success for getting this job, or just being able to have a lot of job offers when I was looking, is just having that network. I told everybody, I was like, hey, like even people like I barely talk to, but I was like, hey, D4 from Temple, we met here. Like, do you know of anybody looking in the area for like a Philly associate? Like, what do you think about this guy? What do you think about this practice? We're pretty good friends now, and I just met him through ASDA, and of course, like, ASDA's fun. Like, we're just like a little tipsy. Like, we were not friends before, and like I think like he helped play a role. Same thing. I think it just opens up a lot of opportunities, because my biggest connection for like Aspen, Alex Mitchell, was at the D3, like the spring conference, whatever. That was just there, and I was like, hey Alex, like I need a job in Philly, can you hook me up? And he hooked me up. So like I think whatever you're looking for, you can find it there.
Great, thank you, Dr. Alex Mitchell's a great guy. He's awesome when it comes to that. He loves recruiting. He loves bringing people on board. So he's awesome. So last question to round out this Ask Me Anything session with Dr. Oy. We have a question that came in that one of the students submitted. I think it's a fascinating question, and I'm even interested to learn a little bit more about you as well. What do you enjoy the most about dentistry? When you wake up in the morning and you go to work every day, or when you leave the office every evening, what can you look back and just think about, what makes it so fulfilling? And I know that you work so hard. All the students on this session work super hard for four years, right? So what do you enjoy the most about dentistry, Dr. Oy?
For me, it's problem solving. I'm a very logical person. Like my favorite subjects in schools were math and science. Like you can't argue with it. If you didn't get the right number, like it's wrong. But I like getting to an answer for people. And in dentistry, it's very fulfilling because you have a personality. You have a person. You have somebody who could be introverted or somebody who's extroverted. And how do you kind of navigate that? How do you navigate the financial barrier or even their time and their schedule? Like treatment planning for somebody who is retired is a lot different from somebody who works a 9-to-5 job and lives paycheck to paycheck. It doesn't mean one treatment plan is better than the other, but I like being able to navigate and, get people to their ultimate goal of, one, whether it's out of pain, or two, giving them a smile that they're happy for, or, just like getting them to good health and just like checking something off their list by them saying, it's like, hey, I went to the dentist. And I think for our office too, like DSO or corporate dentistry, like there's that stigma that's there. And Dr. Niv and I think we're really excited to just kind of bring like a personalized, exciting experience. Like if you look at our reviews online, a lot of people are like, it was like visiting a friend or family, like, no, like I've never had a dental experience like this before. And ask yourself that question, like, why is it miserable going to the doctor's office or even the dentist? Like, why can't it be fun? And it just starts with the conversation with that person, because it's not just teeth, it's a human being behind it.
Thank you so much, Dr. Oy. You were awesome. I want to thank you for taking the time out to speak with the students of Maryland, your alma mater, and you're super relatable. You just graduated less than a year ago. So you're kind of, what they're going through with COVID and, the kind of having to adapt during the pandemic and kind of being anxious to begin your professional career during these times. And I just want to thank you so much for giving your unique and awesome insight on your professional career at Aspen Dental and when you were a student at Maryland as well. I also really want to thank the students that attended. Please feel free, if you have any additional questions, feel free to reach out. Please let me know. You all have my email for when you signed up for the session. Please, if you have a question for Dr. Oy, let me know as well. I'll relay that message to her. If you want to speak with her, if you want to speak with me, please reach out. Also with the raffle for the AirPods, I will be pulling that tonight. So I'll be on the lookout for that. I'll be choosing the winner. So I want to thank all the students. Good luck with your semester. And have an awesome night. Thank you so much, Dr. Oy. Really, really appreciate it.
Best of luck, everybody. So good to see some familiar names.